Hello and welcome to this presentation. This presentation touches on two topics: healthcare interpreting and interpreting in legal settings. Let's start with the first one, healthcare interpreting. Healthcare interpreting is what happens in hospitals, in clinics, in emergency rooms, during mental health sessions, and in rehab. Let's start with this quote from Hale. She quotes a survey that was conducted by two medical practitioners. There were residents and there were patients that they asked to rate their satisfaction with the interpretation done by family or friends compared to interpreters, staff interpreters. When we say staff interpreters, we mean interpreters who are working full-time in a hospital. The friends received a 62% satisfaction rate from the residents and 85.1% satisfaction rate from the patients. Staff interpreters, on the other hand, received 98% satisfaction from the residents and 92.4% satisfaction rate from the patients. The conclusion reached by the survey conductors was that the satisfaction rate for family and friends was high enough not to warrant the expense of a staff interpreter. So the patients didn't really mind whether the one interpreting was their friend, their family, or a staff interpreter. The problem here is that this survey has jumped to a conclusion without any scientific basis. They assume that these people can really judge interpretation and whether it went correctly or not. The patients and the residents are not reliable assessors of interpreters' performance, specifically because they are monolingual. In addition, there are so many psychological and sociological factors that come into play. I will touch on a few things that are often done by professional interpreters and make a lot of difference. The first one is the pre-session. According to the National Council on Interpreting in Healthcare, a pre-session is a short discussion held prior to the interpreted session. It happens between the interpreter and the service provider, or between the interpreter and the limited English proficient patient, or all three of them together. In the pre-session, the interpreter introduces herself or himself, what they will do, how they will speak in the first person, and how everything that is said in the session will be repeated. This is very different from what happens when the family member is interpreting. They do not use the first person. They may not interpret everything that is said. So many things can go wrong. The pre-session serves two purposes. For the patient, the pre-session serves to introduce the interpreter, establish rapport, inform the patient as to how the interpreter will work, and allow the interpreter to assure that he or she can understand the patient's speech. As for the provider, the pre-session serves to introduce the interpreter, establish a collegial relationship because the interpreter is part of the healthcare team, inform the provider as to how the interpreter will work, and provide the opportunity for the provider to share any information about the upcoming session that might be helpful to the interpreter. If the provider is going to share some very bad news that will change the patient's life, for example, it's very useful to share that with the interpreter beforehand. Then the interpreter will be better prepared for the appointment. Positioning. This is another issue that shows a great difference between a professional interpreter and family members. The interpreter decides where he or she will stand or sit during each appointment. it is their responsibility. What they take into consideration here is the safety of everyone, that the parties speak to each other directly, and that the communication is well established. So, in a regular examination, the appropriate positioning will be for the interpreter to be seated next to the patient, facing the doctor, instead of standing over a seated patient or sitting exactly in the middle, because when you sit in the middle, both of them will look at you instead of looking at each other. Again, as I said, it falls on the interpreter to decide where do they stand. Now we come to rapport and level of participation. The degree to which an interpreter establishes rapport may impact a patient's level of participation in the healthcare process, which in turn determines his or her treatment compliance and ultimately the quality of the care they receive. Many of the LEP patients come from minority groups where the power balance in such appointments affects them negatively. They are not used to speaking to people of higher power, and they think or regard the healthcare provider at a higher level. But if they feel that the interpreter is representing them, is reflecting how they feel and what they want to say, many times they become eager to participate in a much better way than they would usually do. And this, of course, will eventually affect the quality of the care they receive. This takes us to the issue of visibility. Compared to working in court, medical interpreters are a lot more visible and personally involved in the communicative situation. We will discuss court interpreting later, but for now, it's important to know that court interpreters are not allowed to advocate for the LEP. However, a medical interpreter, to some extent, can use her own or his own voice to advocate for the LEP. When we speak of visibility here, we are speaking of the interpreter's use of his or her own voice and wits as a mediator, as opposed to just the mechanics of oral transfer. Now shifting gears to legal interpreting. There are certain places, certain settings where legal interpreting usually takes place. One of them is law offices, when you assist attorneys in their interviews, in their meetings with LEP clients. This is when they prepare for court, they explain the case, and so on. Sometimes they also do depositions. Depositions is what happens when an attorney wants to take the testimony of a witness outside of court. Also, there are the DA's offices. They sometimes need help with interpreting when they have interviews to a witness or a suspect in a crime. Sometimes they contact you directly, sometimes they contact you through the language access office within the court system. This changes, and it depends on how the judicial department works in the state you're working in. Other places that you can work in as a court or as a legal interpreter is definitely the court system, the federal court or the different state courts, and there will be so many types of cases that you can help with. There is also the Department of Homeland Security, or the USCIS. These are two places where you can help LEPs with their interviews, their immigration meetings or interviews, the asylum, and so on. There are other entities that may need legal interpreting, like the Social Security Administration, the U.S. Department of Labor, the Food and Drug Administration, Child Protective Services. All these places also need interpreters. It's very important to remember that what you interpret in these settings is sometimes used to be the legal record. So what the LEP says in their language is not necessarily part of the record, but what you say may very well be. So there are certain issues that may come up, and the interpreter has to deal with them. One of them is overlapping speech. In interviews or in interrogations, cross-examinations, people may speak, more than one person may speak, and this is also especially true for remote interpreting. The interpreter here has to make it clear that they will not be able to interpret if more than one person speak at a time. Sometimes there is vague, indirect, or evasive language, especially used with attorneys. Attorneys can sometimes be really mean in how they cross-examine witnesses or examine witnesses. And as an interpreter, you may be aware of what is going on, but you also have your duties, and you have to stick to your code of ethics. There are also a lot of subtleties related to register. You will be interpreting to people coming from all walks of life. Judges who will use a very high register, and witnesses who are not very well educated and may not be familiar with sophisticated language, and may very well use a very low register. Of course, there is also the issue of inappropriate language, offensive words, that these things happen quite a lot, quite frequently in court interpreting or legal settings. There is, of course, cultural specific language, and there is the pressure of this interaction being an adversarial situation. This is very different from interpreting at school, where everybody has the student's best interest in mind. It's different from the hospital, when we all want the best health outcomes for the patient. In the court, it's quite different. There are certain ways that can help you deal with these difficult circumstances or these challenges. One of them is pre-training those people who work in these institutions, judges, attorneys, on how to work with an interpreter. Also, increasing training and certification amongst interpreters is very important. The interpreter has to be able to state clearly what is their obligation and what they need to do. And interpreters should be allowed a greater role in managing the different parties and the conversation. So this was a quick look at two areas of interpreting: healthcare and legal settings. I hope you find them useful, and thank you very much for listening.